The onset of hantavirus pulmonary syndrome often arrives with a deceptive simplicity, masking a physiological crisis that can move from fatigue to total respiratory failure in a matter of days. As of mid-May 2026, international health agencies are focusing their surveillance on a specific and deadly cluster of cases that has reignited global concerns over the Andes virus strain. The narrative of hantavirus often begins in the most mundane of settings: rural cabins, backyard sheds, or long-ignored attics. For many patients, the first sign of trouble is not a high fever or a persistent cough, but a deep throat-atching soreness in the large muscle groups, often appearing shortly after routine household chores like sweeping out a garage or clearing a woodpile. This muscle pain, specifically localized in the thighs, hips, and back, frequently follows the inhalation of aerosolized particles from infected rodent droppings, urine, or saliva. While the initial symptoms might be dismissed as overexertion or a seasonal flu, public health officials warn that these early aches are the precursor to a rapid inflammatory cascade. Once the virus enters the lungs, it begins to leak plasma into the alveolar spaces, essentially drowning the patient from the inside. The current 2026 landscape is dominated by an unusual multi-country outbreak linked to a Dutch-flagged expedition vessel, the MV Hondius, which has tracked the virus from the southern tip of Argentina into the Atlantic and eventually to the Canary Islands. This specific event has highlighted the unique dangers of the Andes virus, a hantavirus variant primarily found in South America that remains the only known strain capable of interhuman transmission. According to the World Health Organization and the Centers for Disease Control and Prevention, the current cluster involves at least 11 cases, including 9 laboratory-confirmed infections and 3 deaths. The index case is believed to have contracted the virus through environmental exposure in Ushuaia, Argentina, prior to boarding. This highlights the primary transmission mechanism, the spillover from rodent reservoirs to humans. In the Americas, the Sin Nombre and Andes viruses are the primary culprits, carried by deer mice and long-tailed pygmy rice rats. When their waste is disturbed, often during simple cleaning chores, the virus becomes airborne. Public health reporting stresses that there is no safe amount of exposure. The microscopic nature of these particles means that a single afternoon spent in a dusty shed can lead to a terminal clinical outcome if the correct precautions are not taken. As we examine the current reporting, the framing of this disease as a finality stems from its high case fatality rate, which historically fluctuates between 35% and 50% in the Americas. Unlike more common respiratory viruses, hantavirus does not typically spread through casual social contact in most of its forms. Yet the Andes variant has forced a shift in surveillance strategies. The European Center for Disease Prevention and Control has deployed experts to monitor passengers across 23 countries, underscoring that while the risk to the general public remains low, the clinical reality for those infected is severe. The transition from the prodromal phase, the period of fever and muscle aches, to the cardiopulmonary phase can occur in as little as 24 hours. For the individuals aboard the MV Hondius and the rural residents of a southern cone, the trajectory from a simple chore to a ventilator is a stark reminder of the lethal intersection between human activity and zoonotic reservoirs. This report will detail the specific agency responses, the latest laboratory data from the 2026 cluster, and the rigorous prevention protocols that remain the only effective defense against a virus with no known cure. The clinical and logistical response to the May 2026 hantavirus cluster has mobilized a network of international agencies, including the World Health Organization, the Pan-American Health Organization, and the Africa CDC. Core developments began on May 2nd, when the United Kingdom notified the WHO of a cluster of severe acute respiratory illnesses aboard the MV Hondius. The vessel, which had traveled from Argentina through remote locations including Antarctica and South Georgia Island, became a floating laboratory for epidemiological investigation. Testing conducted by the EU Reference Laboratory for Public Health confirmed the presence of the Andes virus, or ANDV, in multiple passengers. This strain is particularly scrutinized by labs because of its documented ability to spread through close, prolonged contact between humans, a rarity among hantaviruses, which are usually dead-end infections in people. The Spanish Health Ministry recently confirmed that an evacuated passenger tested positive and is currently in isolation at a military hospital in Madrid, while others remain under strict monitoring. This highlights the difficulty in diagnostics. The early symptoms of fever, headache, and myalgia are nonspecific, frequently leading to delays in the critical supportive care required to manage the later stages of the disease. Laboratory sequencing of the 2026 samples suggests that the cases stem from a very recent zoonotic spillover event, with no immediate indication of increased transmissibility compared to previous Andes virus outbreaks in Patagonia. However, the data provided by PEJO for the preceding year, 2025, shows a concerning upward trend in hantavirus activity across the Americas. In 2025 alone, 8 countries reported a total of 229 confirmed cases of hantavirus pulmonary syndrome, resulting in 59 deaths, a regional case fatality rate of nearly 26%. Bolivia and Paraguay, in particular, saw incidence rates that doubled their historical averages, often linked to occupational exposures in logging and agriculture. The contrast between verified clinical data and public perception is significant. While tabloid reports may lean towards sensationalism, the medical reality reported by agencies like the CDC is focused on the rapid progression from gastrointestinal distress to acute respiratory distress syndrome. Patients often experience a crash where their blood pressure drops and their lungs fill with fluid, requiring immediate referral to an intensive care unit. International trade and travel logistics have also been impacted by the 2026 outbreak. The European Commission has triggered the Early Warning and Response System, coordinating the safe disembarkation and repatriation of passengers under strict infection prevention and control measures. The Africa CDC has also maintained a high state of alert, monitoring the ship's movements through Cape Verde and the Canary Islands. These agencies are working to distinguish between the Andes virus and other hantaviruses, such as the Pumala or Dubrava strains found in Europe, which typically cause hemorrhagic fever with Raynaud syndrome, a severe but usually less fatal condition than the pulmonary syndrome seen in the Americas. Current laboratory reports emphasize that while the Andes strain is the only one confirmed for person-to-person spread, the risk remains confined to those with close physical contact or exposure to bodily fluids. For public health labs, the challenge remains the 42-day incubation period, which allows infected individuals to travel long distances before symptoms manifest, necessitating the robust international contact tracing efforts currently underway. Prevention and public guidance for hantavirus remain anchored in rodent control and environmental hygiene, as there is currently no licensed vaccine or specific antiviral treatment for the infection. Public health agencies like the CDC and the European Center for Disease Prevention and Control emphasize a wet cleaning protocol that is critical for anyone entering potentially infested areas. Because the virus is transmitted through inhaled dust, the act of dry sweeping or vacuuming rodent-infested spaces can be a fatal mistake. Officials advise saturating droppings and nesting materials with a mixture of bleach and water or a high-strength disinfectant for at least 5 minutes before wiping them up with paper towels. This preventive measure is vital for rural residents and travelers alike, as it neutralizes the virus before it can become aerosolized. Additionally, sealing entry points into homes, any gap larger than a pencil's width, and utilizing snap traps rather than live release traps are standard recommendations to reduce the local rodent reservoir. The limits of our current knowledge are most apparent in the clinical management of the disease. While medical technology has advanced, the primary treatment for hantavirus pulmonary syndrome remains supportive care. This includes the use of extracorporeal membrane oxygenation, or ECMO, and mechanical ventilation to sustain the patient while the body fights the infection. The honest limit of current science is that we cannot yet kill the virus once it has taken hold. We can only support the heart and lungs in hopes of a recovery. Surveillance in 2026 has shown that early intervention is the single greatest factor in survival. When clinicians are alerted to a history of rodent exposure or recent travel to endemic areas like the southern cone of South America or the American Southwest, they can initiate ICU-level monitoring before the catastrophic respiratory phase begins. In the United States, 2025 saw cases spanning from Washington to Wisconsin, proving that while the virus is rare, its geographical footprint is expanding. Possibly due to shifting climate patterns affecting rodent populations and behavior, as the MV Hondius undergoes deep disinfection in the Netherlands and global health officials continue to track the 2026 cluster, the message to the public remains one of calm but rigorous caution. The Hantavirus is a reminder of the persistent risks at the edge of the wilderness and within the forgotten corners of our own homes. Health departments continue to monitor the antisense virus sequences for any signs of mutation that might increase its ease of spread, though no such evidence exists today. The current strategy is one of aggressive surveillance and public education, aiming to ensure that the muscle pain after chores is recognized by both patients and doctors as a potential red flag rather than a minor inconvenience. By maintaining a clear-eyed view of the data and adhering to established hygiene protocols, the impact of this rare but devastating pathogen can be mitigated. For ongoing updates on global health surveillance and emerging viral threats, consider staying tuned to official agency reports. Please subscribe for more in-depth reporting on public health developments. The core of the current investigation centers on the MV Hondius, a Dutch-flagged expedition ship that has become the focal point of an unprecedented cross-continental public health response. Following the initial notification to the World Health Organization on May 2, 2026, the logistical trail has expanded across multiple maritime jurisdictions. The vessel's journey, which began in the southern port of Outbreak, Argentina, included stops in the Falkland Islands, South Georgia, and several locations along the Antarctic Peninsula before heading north toward the Canary Islands and eventually the Netherlands. This expansive itinerary has forced a massive contact tracing effort led by the European Center for Disease Prevention and Control, involving at least 23 countries whose citizens were aboard the ship. The clinical developments took a critical turn when the Spanish Health Ministry confirmed that a passenger evacuated in the Canary Islands tested positive for the Andes virus strain. This patient remains in strict isolation at a specialized military facility in Madrid, where medical teams are managing the transition from the early febrile stage to the much more dangerous cardiopulmonary phase. Laboratory verification has been the primary bottleneck in managing the current cluster, primarily due to the unique properties of hantaviruses. Unlike more common respiratory pathogens, hantavirus RNA can be difficult to detect in the very early stages of infection, often requiring specialized polymerase chain reaction, or PCR, testing that is only available at high-containment reference laboratories. In this instance, the EU Reference Laboratory for Public Health has been working to sequence the viral samples to determine if there has been any significant drift in the Andes virus genome. The Andes virus is uniquely dangerous because it is currently the only known hantavirus capable of interhuman transmission, typically requiring close and prolonged physical contact. Scientists are currently investigating whether the confined environment of the expedition ship, coupled with the long incubation period of up to 42 days, created a perfect storm for the cluster of 11 cases reported so far. This includes 9 laboratory-confirmed infections and 3 fatalities that occurred before the ship could reach European waters. When comparing official data against media reports, public health agencies have been quick to clarify the actual risk levels. While some reports have used sensationalist language to describe the finality of the virus, the Pan American Health Organization's verified data from 2025 provides a more measured but still sobering baseline. Last year, 229 cases were confirmed across the Americas, with a case fatality rate hovering around 26%. This represents a significant increase in activity, particularly in Bolivia and Paraguay, where land use changes and agricultural expansion have brought humans into more frequent contact with the long-tailed pygmy rice rat, the primary reservoir for the Andes strain. In North America, the sin nombre virus remains the dominant threat, though it does not share the Andes strain's capacity for person-to-person spread. The distinction is critical for hospital protocols, while all hantavirus patients require high-level supportive care. The Andes variant necessitates the use of enhanced personal protective equipment and strict isolation to prevent secondary infections among healthcare workers and family members. The logistical and trade implications of the May 2026 outbreak are already being felt in the shipping industry. The European Commission has activated the Early Warning and Response System, or EWRS, to coordinate the disembarkation of over 100 passengers as the MV Hondius reaches its final destination in the Netherlands. This process involves the Africa CDC, which monitored the ship's transit through the Atlantic, and Dutch port authorities who have designated a sterile zone for medical screening. The uncertainty regarding the index case, the first person to contract the virus, remains a major focus for investigators. If the exposure happened in the environment during a landing in Argentina, the risk to the broader community is significantly lower than if the virus was circulating undetected among the crew for weeks. This ongoing investigation into the timeline of symptoms versus the ship's log is essential for understanding whether current screening measures at international ports are sufficient to catch a virus that can lay dormant for over a month before causing a patient's lungs to fail. The primary defense against hantavirus pulmonary syndrome remains rooted in proactive environmental management and the strict avoidance of aerosolizing viral particles. Public health guidance, reinforced by the Centers for Disease Control and Prevention and the World Health Organization during this 2026 outbreak, centers on a protocol known as wet cleaning. Because hantaviruses are enveloped viruses that can survive for several days in the environment under the right conditions, they are highly susceptible to common disinfectants. However, the danger lies in the physical act of cleaning. Dry sweeping or using a vacuum cleaner in a rodent-infested cabin, shed, or attic can launch microscopic viral particles into the air, where they are easily inhaled. To prevent this, officials instruct individuals to wear rubber or plastic gloves and thoroughly saturate any area containing rodent droppings, urine, or nesting materials with a disinfectant solution, typically a mixture of 1.5 cups of household bleach per gallon of water. This material must remain wet for at least 5 minutes before being wiped up with a paper towel or cloth. By ensuring the waste is never dry during the cleaning process, the risk of creating a lethal bioaerosol is significantly reduced. This practice is especially critical for seasonal travelers and outdoor enthusiasts who may be opening up summer cabins or storage units that have been vacant for several months. In the broader context of surveillance, the 2026 Andes virus cluster has underscored the need for vigilant monitoring of rodent populations and their proximity to human dwellings. The long-tailed pygmy rice rat, the primary carrier of the Andes strain in South America, and the deer mouse in North America often seek shelter indoors during shifts in weather or following changes in local ecosystems. Public health departments are now utilizing predictive modeling to identify hot zones where increased rainfall or agricultural shifts might lead to a surge in rodent populations, a phenomenon known as a trophic cascade. Surveillance also extends to the clinical level, where the 42-day incubation period creates a difficult window for epidemiologists. As seen with the passengers of the MV Hondius, an individual can be exposed in a remote part of the world and not show symptoms until they have traveled across continents. This requires a level of international data sharing that is currently being tested. While the Andes strain is the only variant confirmed for person-to-person transmission, scientists remain on high alert for any similar mutations in other strains, such as the sin nombre virus, which could fundamentally alter the risk profile of the disease globally. There are, however, honest limits to our current scientific understanding and medical capabilities regarding hantavirus. Despite decades of research, there is no licensed vaccine and no specific antiviral drug that can stop the virus once it begins attacking the endothelial cells in the lungs. Clinical management is entirely supportive, relying on advanced technologies like extracorporeal membrane oxygenation, or ECMO, to oxygenate the blood outside the body while the lungs are incapacitated. The finality, often associated with the disease, refers to this critical window where medical intervention is the only thing standing between a patient and total respiratory collapse. Ethical reporting requires acknowledging that for many in rural or underserved regions, access to such high-level intensive care is not always immediate. This disparity in healthcare infrastructure remains a significant hurdle in reducing the overall mortality rate of the disease. Furthermore, the exact mechanism that allows the Andes virus to transmit between humans while other strains do not remains a subject of intense laboratory study, representing a gap in our knowledge that has profound implications for future pandemic preparedness. The 2026 outbreak serves as a sobering reminder that our interaction with the natural world carries inherent risks that require constant vigilance. As the passengers from the MV Hondius complete their observation periods and the focus shifts to disinfecting the vessel, the broader public health community is left with a clear mandate. Education is as vital as medication. A calm, evidence-based approach is necessary to prevent panic while ensuring that those at risk, lodgers, hikers, and rural homeowners, understand the gravity of the symptoms. Muscle aches and fever in the weeks following a